calcium. So hypercalcemia, that's a level above 10.6 milligrams per deciliter. The normal reference range for calcium is 8.5 to 10.6 milligrams per deciliter. Having too much calcium in the blood is most often associated with the endocrine disorder, which is hyperparathyroidism. But it can also be associated with some medications like thiazide, diuretics, and lithium. Also, some forms of cancer like breast cancer, lung cancer, multiple myeloma, Paget's disease, non-weight-bearing activity, and elevated levels of calcitriol can also occur with sarcoidosis and tuberculosis. So hypercalcemia is characterized by thirst, renal stones, anorexia, paresthesia, urinary frequency, bone pain, muscular weakness, confusion, abdominal pain, depression, fatigue, lethargy, constipation, nausea, and vomiting. So treatments for this can include IV hydration and medication like prednisone, which is a steroid, diuretics, and biphosphonates. Symptomatic relief measures and interventions can include analgesia, so any kind of pain medication, to decrease the client's pain level, vitamin D and A, and the protection of clients against injuries and accidents such as falls, given that pathological bone fractures can occur secondary to bone decalcification that occurs in many cases of hypercalcemia. Because magnesium levels are highly associated with calcium levels, it's often necessary to also correct and treat the magnesium levels before the calcium levels can be corrected. Calcium and magnesium, they generally go hand in hand. If you see one's going up, the other probably is as well. So they're often related. So on the other hand, hypocalcemia, having too little, you will do this with, most health assessments. This question you definitely need to know. There is what's called, I'm not exactly sure how to pronounce this person's last name, so I apologize, but Chvostek sign, where you pinch the cheek and it's just seeing if the muscle is contracting. So that level below 8.5 can be a result of renal disease, inadequate dietary calcium, vitamin D deficiency, because vitamin D and calcium also go hand in hand. You need vitamin D to absorb the calcium. A low magnesium level, pancreatitis, hypoparathyroidism, eating disorders, and certain medications like anticonvulsants, alendronate, ibandronate, biophosphonates, rifampin, phenytoin, phenobarbital, corticosteroids, plisomycin, and others. So symptoms can range from barely noticeable to severely life-threatening. Some of these signs and symptoms include muscular aches and pains, bronchospasm, which can cause respiratory problems, seizures, tetany, and life-threatening cardiac arrhythmias, and tingling of the feet, fingers, tongue, and lips. So basically you can have paresthesias with too much or too little. Sometimes certain conditions are not necessarily about being opposites, because it's really just when we're out of the normal range, on either end of the spectrum. Like the paresthesias are a good example. If your muscles aren't, muscle and nerve function is compromised, it can occur in both cases. So the treatment for this includes monitoring the patient's respiratory and cardiac status, in addition to providing the client calcium supplements coupled with vitamin D, because vitamin D is necessary for the absorption of calcium, like we were just discussing.